Hey everyone, just wanted to talk about contact lens solution today for soft contacts because I do get this question a lot from patients, and I think it's something we kind of forget about because you're just so used to doing it, and after a while you forget a step or forget to read the directions or whatever it may be. So this is for soft contact lens wearers that are not wearing daily contacts. So those maybe that are in a 2-week or a monthly replacement where you're having to clean them at night and put them into solution. The most common is probably something similar to like the Opti-Free. There's other brands out there as well, such as Renew. That's a pretty common one. And that's a multi-purpose solution, which just means you can use it for everything. You're going to clean and disinfect the lenses. You are going to store the lenses, and you can even put this right into your eye if you need to as well. One step that I feel like a lot of patients forget to do is when you take the contacts out, and before you put them in, you should always clean them a little bit. You're just gonna put a little bit of solution in the palm of your hand, just gently rub that contact around for a couple of seconds, that's it. Then either put it in your case for the night or put them in your eyes for the day. Those few seconds of rubbing that contact with some solution really gets the deposits off a lot better. And then always remember, in your case, clean solution every single time. Never reuse the solution from the day before. Kind of like when you wash dishes. You never leave the water in the sink to use it again next time, so always make sure that you're using clean stuff. No matter which multi-purpose solution you do choose to use, it should always feel good. You should never have any stinging or burning, even for a split second. Usually that means you're allergic to something in the solution, primarily the preservatives. There's a lot of store brands out there like Walmart, Target, Costco. You can get their brand of solutions too. Sometimes patients tend to have more trouble with those just because they're using the older formulation, but people can have allergies to the name brands too, so that's just a general for any solution. Some patients out there are using a hydrogen peroxide system. Clear Care is a pretty common one. This is great if people do have allergies to preservatives because this one is preservative free when it's all said and done. The directions are a little bit different. You're going to use the special case that comes with the Clear Care. Don't use the flat cases, not gonna work. You also cannot put these solutions directly into your eye. Please do not do that. You will give yourself a chemical burn and then you won't make that mistake twice. Make sure you fill the case to the line where it's designated. Make sure you got the cover on tight, set it up right. Most of them read the directions, but most of them are going to be 6 hours. They've got to be in there that long. Don't take them out early or you'll give yourself a chemical burn. But they can be really great for getting the deposits off the lenses, can be good for those with allergies as well. Some people like to use saline solutions to rinse their contacts. You can if you want to. It's not required. You don't have to. But just make sure that you know that saline solution does not disinfect or clean your lenses. So don't be using that as your primary way to clean and store the lenses because it's not. It's just saline. Make sure you're using an actual contact lens solution for that. And as always, if you have any questions, make sure you ask your eye doctor. You can help determine if you're having problems with certain contact lens solutions, if you should be using something else. Those are always great questions to ask at every single exam just to make sure you're using the correct thing. So there's your tip on contact lens solutions.